Bringing healthcare onto the blockchain, that's the goal of Solve.Care. The Arizona-based company recently launched a solution for 5,500 physicians in the Arizona Care network. On top of that, the first medical center of ACN has already begun redeeming Care.Coins, the native digital currency of Solve.Care Platform. This makes Solve.Care the first company to implement a blockchain-based digital currency to be used by healthcare providers. The CEO, Pradeep Goel, spent more than 26 years building successful healthcare IT companies. Along with being featured on Goldman Sachs' 100 Most Promising Entrepreneurs, he has been tapped to work with healthcare initiatives of the US presidents. This includes developing both Medicare and Medicine. While he has an impressive pedigree, revolutionizing the American healthcare system is no small task. Let's go to Pradeep Goel to find more about Solve.Care and his plans for future of medicine.
Healthcare provision worldwide has become highly inefficient and expensive. In the U.S. alone, up to $1 trillion is wasted through administrative costs, overutilization, and fraud. This waste is caused by outdated and cumbersome healthcare systems, which place an enormous strain on patients, doctors, and administrators. A change is urgently needed. Meet Solve.Care, the global blockchain solution for healthcare coordination, administration, and payment. The Solve.Care platform harnesses blockchain technology to reduce the hefty clinical and IT system costs attached to our current healthcare structure. Solve.Care's ecosystem connects patients, doctors, employers, and insurers. The platform consists of the Care Wallet, Care Cards, the Care Marketplace, and Care.Coin. The center of the Solve.Care experience is the Care Wallet Personalized Healthcare Coordinator, which allows patients and providers to administer healthcare in an easy way. The Care Wallet functions through decentralized healthcare apps called Care Cards. With Care Cards, patients can enroll in health insurance, manage health insurance benefits, make instant appointments, review and pay bills. Doctors can issue prescriptions and coordinate with specialists. Employers can administer benefits and reduce costs. As the care community evolves, further utility and value will be added through Care Marketplace, an app store where developers can build and release their own Care Card applications. The Solve.Care platform runs on two tokens, Care.Coin and Solve Token. Care.Coin is a stable payment token used to pay doctors, labs, and hospitals. The Solve Token is the gas of the platform, used to conduct transactions and access Solve.Care's tools and services. Taken together, the Solve.Care system makes healthcare higher quality, more affordable, and easier for everyone. The future of healthcare is here.
Being able to identify the key problems is the key talent of a good entrepreneur. Now, with Solve.Care, Pradeep Goel found it very difficult to find an appointment for his own son, which is why he decided to go on and change the way the medical industry works. We met him at the Blockchain Summit. Now have a look. Welcome to Bloxlive TV, the channel that brings you all the latest innovation in blockchain and crypto. Now, joining me is someone who's working on ways to revolutionize healthcare. Pradeep from Solve.Care, thank you so much for taking your time and joining us here at Blox. Healthcare is obviously one of the things that we all feel passionate about, and I think you had some experience where you wanted to solve a real issue. Could you just talk us through a bit of that?
Sure. So I grew up in healthcare in the US, and I've been on all sides of healthcare, administrative, government, clinical, and have been CIO of a major insurance company. So I knew the healthcare plumbing, if you will. But then a few years ago when my son got sick, I realized that we really don't serve the patient as well as we should, and all the challenges of coordinating care. So it was a big moment in time to say, okay, we need to change the way we deliver healthcare in the US and around the world. And then happened to be the right time also to look at decentralized processes and distributed ledgers that blockchain offers. So the need and the opportunity collided, and end result is we are really at the cusp of changing the way healthcare works.
And just in general aspect of things, at the moment, the world is going through a massive change and there's more strains on the healthcare system everywhere. What can blockchain do to help that?
So there are really 3 or 4 different tracks in healthcare where there's clear value, and it's really around patient centricity. So the first is making access to care easier and more timely. Despite however developed or underdeveloped your healthcare system is, it's of no value if the patient can't get to it. And there are always administrative barriers to getting to the right care, be it as simple as finding a physician that's available from an appointment perspective, or if you have an insurance plan, knowing which physician you can see, proving your eligibility, making sure that you actually have transportation to get to the physician, making sure that once you get the prescription, you can fill it and you can use it, you can refill it. The healthcare is never an individual function. It's a team sport. You have yourself, your family members, your physician, your specialist, your pharmacy, your lab, and all of these people need to stay in sync somehow. And today we try to do that through manual processes, emails, phone calls, walking over to the clinic, and those are all barriers to timely care. Especially when you're sick or your loved ones are sick, the last thing you need is administrative barriers. So we're very focused on finding and eliminating in each different healthcare model these barriers to where you can actually see the physician on a timely basis.
And how are you doing it yourself? I know you've got some projects in the US where you implement blockchain. So what's going on there?
So we have a variety of different projects in the US, in Canada, and around the world, and they depend upon the local jurisdiction. So I'll give you an example. In the US, we are working on a program using blockchain where pregnant women who need to go in and get checked on a regular basis to avoid any post-delivery or post-delivery complications, making sure they have transportation. So the employer or the government agency or the physician themselves can issue them a blockchain card that allows them to get transportation from home to the physician and back, and similarly coordinate that time off with the employer. And the chain gives transparency into who is going to whom, when they need to leave, when they need to arrive, what is the purpose, who's paying for it, and then who should authorize that care, be it the employer or the government. And that coordination today is very complicated. It takes literally dozens of people on the call center, if you are lucky to have such a care coordination function, to make that happen. So the result is a lot of women don't go. So they end up with avoidable pregnancy issues, and even mortality rate during pregnancy is unacceptably high. That's just one example on what we are doing. So disease by disease, condition by condition, we are implementing programs on chain where the right people get coordinated to achieve the best possible result.
And now that is certainly a big issue, but isn't that something that could be done without blockchain as well?
Well, of course. I mean, healthcare was delivered before blockchain existed, and healthcare does not depend upon blockchain. But the things that we are trying to do with the chain are much more effective than they were before. So we all existed before the internet, but internet makes our life a lot easier. The blockchain in healthcare has such a profound impact on my ability as a patient to access and manage my healthcare that it will change the way things are done, and ought to change the way things are done. And in a few years, we'll ask the question, why didn't we do it sooner? So the question isn't, can healthcare be delivered without blockchain? Of course, it can be and has been. But the question here is, how can we make it better? And the opportunities are profound. I'll give you another example. We are implementing a diabetes care model around blockchain, which coordinates the prescriber, the pharmacy, the physician, the specialist, and even the family members in ensuring that the patient stays compliant with a long-term diabetic medication regimen. And if they fall off the horse, so to speak, and stop taking their medication on time, a multiple set of people can immediately interact and manage and monitor that and get them back on the regimen. We can share cost. If the cost of insulin is too high, instead of having the patient stop taking insulin and end up in an emergency room, cost sharing between employer, government, community, church, family members instantly on the chain. So the point here is that blockchain does enable a kind of patient-to-patient, patient-provider, patient-payer, patient-employer interaction that would be very, very difficult to do without it.
And you said that it makes it more effective. How much more effective is it?
Well, I mean, if you look at human mortality and human suffering, there is no measurement. We are estimating that in this diabetic care program, we will avoid anywhere between, we can't put a metric on it, but let me give an example. If you have diabetes and you have cardiovascular disease, the probability of heart attack is very high. what is the value of saving one person from dying from that avoidable heart attack? And when you apply that across 100,000 patients with the same condition, and you save 10%, you just save 10,000 lives. So what is the value of that? And how much money do we save for society in the avoidable emergency room cost, in the avoidable medical costs? So there is tremendous ROI. The ROI depends upon the program. What is the cost of a child not having birth complications and having a lifelong disease? How do we even measure how much money and pain and suffering we avoided by having a child be born healthy versus born sick? So there is a tremendous ROI both into the pure economic terms, and there's an incalculable value in terms of human suffering that we can avoid and should avoid.
And just in terms of what you're actually doing and medical records, obviously those are sensitive pieces of information. How are you handling that?
So we are not storing clinical data on the chain. We are not interested in being a medical record chain. We are interested in facilitating the administrative, financial, and clinical quality and clinical outcomes. So the data about clinical records, medical records, stay where they are today in electronic medical record systems in the hands of the patient or the doctor. And there are other solutions that are addressing that problem. We are addressing the real fundamental issue of why is healthcare so difficult to use, manage, monitor, measure, and perform, and pay for. So this is very much an administrative, clinical, and financial management system where we can implement programs around diseases, around certain groups of populations, and ensure that they have the right care, and somebody who is paying for it understands that the care is being delivered properly. So this is a very fundamental question around, does the healthcare work as efficiently as banks do? They don't. So how do we make that process very efficient? And that's where blockchain becomes really powerful.
And it is certainly something that's about to change and needs to change. We're reporting about this here at Bloxlive. Thank you so much for joining us, and we will be here telling you all the latest on innovation in crypto and blockchain. The Malta Blockchain Summit 2018 was attended by more than 8,000 people during the opening day alone. For those of you who didn't make it to the crypto island, Bloxlive has you covered. You can follow the day's event on our daily live stream. Also, don't forget to tweet at us at Bloxlive TV. Here's a recap of some of the highlights from the summit on the crypto island. Welcome to Bloxlive TV, welcome to Malta Blockchain Summit, and welcome to Innovation. I'm standing here with Faith Titus from eWealth Management. Now, thank you so much for joining us. You traveled all the way from Nigeria and you've taken your time. Now, thank you so much for taking your time and going all this way. Now, what is it that brings you here?
Well, thank you very much. I actually am into blockchain and cryptocurrency. I started as an enthusiast, and why I'm here is because there are a lot of things that have been said about the blockchain technology, and in my country, Nigeria, not a lot of people understand what the blockchain technology is. Sometimes when you ask them if they know about blockchain technology, they kind of make fun about it, saying that, oh, is it a block that is molded and is chained together? What does it do and all that? Oh yeah, it sounds funny anyway. But I'm also here representing eWealth Atlantic. It is a blockchain technology and cryptocurrency academy which I run in Nigeria because I have a passion to educate people because I have found a very good potential in blockchain. Initially, I was working in a financial institution that was being run by the government, but when I heard about the blockchain technology and the opportunities which it provides, and I said to myself, this is good, okay, and it's going to add value to a lot of Nigerians and Africa as a whole, and that was what actually inspired me. I had to leave my stable job, to find a way to have the academy where I train people, I educate people on the basics of blockchain, what it is and how they can leverage on the opportunities that it brings so they can have a financial inclusion. As you know from statistics, Nigeria is one of the third world countries, that are actually suffering from financial instability, and by so doing, that actually has, has added to, okay, let me just say this.
So, for example, you said that blockchain can add value, and you have a lot of unbanked people in Nigeria. In what way can blockchain help them?
Well, because the traditional system of banking in Nigeria is so expensive, but the blockchain system of I would say financial transaction is not expensive, so it offers the opportunity of people transacting in the local market or doing payment transaction in a very low cost way. So when this is done, or when this is introduced to the unbanked population of Nigeria, it's going to help them to save costs, okay, and thereby translating to them coming out of poverty, because there are not a lot of people who have access, to finance and access to food or to feeding, or some people cannot offer 3 square meals a day, and this is because they don't have money. But the blockchain technology, offers a whole lot of, values, potentials. It could be a financial, sometimes even in the workplace. It eliminates third parties, bureaucracy at workplace. So it makes, transaction, movement, everything, whatever thing you can think of, in every sector. It could be in the financial sector, in the health sector, in the administrative, or in the government, in terms of land administration and titles. It takes away a whole lot of hurdles. It makes life so easy. And ever since I got into this industry, I can tell you my life has never been the same. It has been transformed, both financially. It has given me that exposure to meeting industry and key players, in the blockchain industry, which I believe I have a whole lot of things to work, to learn from them and also to work with them in Nigeria. And again, the second reason I am here is actually to find credible companies, that can actually deploy infrastructures, blockchain infrastructures in my country, because there are a lot of people, Bitcoin users, who are actually looking for, technology, apps where that they can leverage on, that will make all their transactions, easy.
And I need to ask you this question. Okay, blockchain, so for example, you have a direct ledger from one person to another and you transfer in crypto. So the person in Nigeria gets crypto, right? But how do you get around, like we have problems like the government, the corruption and everything else. How can blockchain get around that?
Oh, well, this is where I love about blockchain, because it has to do with transparency. Okay, so I know that there has been a lot of, skepticism in terms of Nigerians. When you mention Nigeria, the first thing that comes to your mind is corruption and all that. Although it is not that much, okay, but I believe that the media, kind of magnify it so much. But I can tell you that there are still transparent people in Nigeria, and deploying the blockchain technology into the government, it will actually, eliminate some form of corruption, from the government, so whereby contracts are being awarded to people. Let's say, for example, they gave a contract of $1 million, to a particular company, to deliver a project. So with the blockchain technology application, it will actually enable whoever that is handling the contract to be more transparent in delivering the contract. Okay, it will not have the person who is in concern won't have that opportunity to lie about his or her expenditure. So all the records, all the financial records with the application of blockchain is going to be, stored on the blockchain, and everybody over there will know that yes, this money was actually given to a particular person, and the money was spent rightly. It was spent for the purpose for which it was given to. So it is actually a good technology to deploy. And the government of Nigeria, it's so unfortunate that a lot of them don't really know about blockchain. But as I told you right now, because I belong to a community of blockchain and cryptocurrency enthusiasts that organizes conferences in Nigeria, okay, and across Africa as well. And so we know much about the blockchain, and I am so happy that right now the governments are, willing to learn about the blockchain technology and how they can apply it in all government offices to be able to eliminate corruption, for the purposes of transparency,
Sure, and transparency is definitely something that we're looking for, and it will be very exciting to see what's going in Nigeria. Here at Bloxlive, we'll definitely be covering that. Thank you so much, Faith, for giving us the time today and giving us the insight in the Nigeria crypto industry. Thank you for watching.